Skill, Adult and Child CPR and AED use. When breathing has stopped, the heart will too. CPR and an AED can help save a life. For CPR, use a mouth-to-barrier device to prevent disease transmission whenever possible. Use the RABCAB mnemonic to remember what to do for CPR. R stands for responsive. Tap the person's shoulder and shout, "Are you okay?" A stands for activate EMS and get an AED. Shout for nearby help. If someone responds, have them call 911 and get an AED while you start CPR. If you are alone and the person is an adult, call 911 and put the phone on speaker mode so that you can prepare to follow the dispatcher's instructions. If a phone is not available, leave the person to locate a phone and get an AED. If you are alone and the person is a child, give 5 sets of 30 chest compressions and 2 breaths before calling 911. B stands for breathing. Place the person on a firm, flat surface. Take 5 to 10 seconds to observe the person from the neck to waist for movement, rise and fall. If the person is not breathing or only gasping, continue to the next step. C stands for compressions. Move enough clothing away from the chest. Place the heel of one hand in the center of the person's chest on the lower half of the breastbone. Place the heel of the other hand on top of the first. Interlock the fingers of both hands to keep your fingers off the person's ribs. The heel of your hand should be the main point of pressure on the chest. A child, use one hand. However, depending upon the child's size and your size, 2 hands may be necessary. Position yourself directly above the person's chest so that your arms are directly above your hands. With your arms straight and elbows locked, push hard and straight down on the breastbone at least 2 inches on the person's breastbone with the heels of your hands. Allow the chest to fully recoil after each compression. Do not lean, rock, bounce, or jab on the chest. Do not stop at the top or bottom of a compression. When performing CPR, deliver 30 compressions at a rate of 100 to 120 per minute. It may be easier to push to the beat of the Bee Gees song, "Stayin' Alive," which is 100 beats per minute, or to the beat from a CPR smartphone app. A stands for airway. Open the person's airway using the head tilt chin lift maneuver. B stands for breaths. Pinch the person's nose shut and make a tight seal with your mouth on the mouth-to-barrier device or the person's mouth. Give 2 breaths, each lasting for 1 second. Do not blow too forcefully or for too long. Take a normal breath for yourself after each breath. Watch for chest rise to determine if your breaths go in. Allow for chest deflation after each breath. When an AED becomes available, use it as soon as possible. Turn on the AED. Open the pads and attach them to the person's bare, dry chest.
Look at pictures on pads. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture.
Pictures on the pads will show where to place them. One pad should be placed on the left side of the chest, left of the nipple, and above the lower rib margin. The second pad should be placed to the right of the breastbone, just below the collarbone and above the right nipple. After applying the AED pads, stay clear of the person. Make sure that no one, including yourself, is touching the patient. Say "clear" and follow the AED voice prompts. Allow the AED to analyze the heart. The AED will prompt one of 2 actions. 1. Stay clear and press the shock button if advised to deliver a shock. 2. Do not give shock, but give CPR, starting with chest compressions. Continue using the AED and CPR until the person moves, begins to breathe, or wakes up, or until EMS takes over.